Breastfeeding patterns. So today I want to talk to you a little bit about what a mother can expect in those first few days or even weeks after birth when it comes to breastfeeding their baby and kind of how often they're going to need to be breastfed. It's a topic that comes up really often within our groups, and I feel like it's because there's so much conflicting information available online, but also because we're surrounded by our families and loved ones immediately after birth, and they like to share their experiences and their knowledge, but it may not be the most up-to-date or relevant information that they're sharing, or it may even conflict with something a health professional has already told them, and that can bring some worry and some anxiety for parents. So what I always think is a really great starting point is when we're talking to parents is about straight after birth how big a baby's stomach is going to be, and it's simply the size of a marble, so it's dinky. That means our colostrum that's perfectly formed in small amounts but highly nutritious and full of antibodies is perfectly designed for it. They'll be able to digest it nice and quickly, which then in turn means they are going to want to be fed quite frequently too. Now, there's no clock to watch when it comes to feeding your babies or when it comes to a mum feeding her baby. It's simply about encouraging responsive feeding. And by responsive feeding, what we mean is we're looking out for those early hunger cues in baby or a mum's need to want to feed her baby, and we're responding to it by offering the breast to baby. It's always great at this point as well to remind a mother that you can never overfeed a breastfed baby. We know sometimes that breastfed babies are coming to the breast not just for nutrition, but comfort, pain relief, and reconnect with mum, and so many other different things too. So it's always a great response to let them know that you can always feed your baby as often as feels natural for you. When we're looking at kind of the minimum of what we expect a baby to feed within a 24-hour period, guidance would tell us we're looking for a minimum of 8 to 12 feeds within that 24-hour period. But for some babies, especially if they're going through something developmentally or if they're going through a growth spurt, it could generally be quite a bit more than that also. Sometimes what we hear mums telling us about as well is a period of the day or the night where a baby will be on and off the breast constantly. This is something we know as cluster feeding and is generally not a reflection at all on mum's supply, but simply that baby is either stocking up on their milk before they go to bed, or they just need that chance to reconnect with mum before they go to sleep and have a bit of time apart. Cluster feeding is a really normal part of infancy, and it's really encouraged to still continue to responsibly feed your baby within this time. So when we're looking at how often we're wanting babies to feed, we're looking for that minimum of 8 to 12 feeds per 24-hour period. But we know there are so many other signs to tell us whether baby's actually getting enough also, including baby's nappy output, wet nappies, dirty nappies, what their behaviour's like in between feeds, and so much more. It's important to highlight that one person's normal breastfeeding pattern may not be the same for another person's breastfeeding pattern. Just encourage that responsive feeding and to be led by their baby when they need to be fed, and that will ensure that baby's getting exactly what they need.